So to put it, whatever we have described, this cartoon will be able to explain us. There is a lot of fat which is happening in the individuals over here, and this fat which is getting deposited in the individuals is getting mobilized to the intra-abdominal areas into the subcutaneous tissue, whereby the subcutaneous fat is increased, the triglycerides are coming down, the free fatty acid levels are also coming down. So this is very, very important. So if you see, even in the muscles, the amount of fatty acids which are deposited inside the muscle is also coming down because of the usage of TZDs. So this is what the TZDs, this is how it acts. So to make it in single line, it reduces the visceral adiposity and takes it to the subcutaneous tissue, and the free fatty acid which are in the blood is also getting decreased. So since the fatty liver or the fatty pancreas is no more having more amount of fat around them, they are able to regenerate and reduce the hepatic insulin resistance, and the insulin sensitivity profile of the individual also improves. Now, we said we will discuss about two trials. Very, very important, very small trials. We will discuss about these trials. The first trial is called as proactive trial. So in this trial, what they have done is 5,238 patients with type 2 diabetes and evidence of macrovascular disease. They were recruited between this period, and they were entered into a controlled double-blind cardiovascular outcome trial with pioglitazone titrated 15 to 45 milligram per day or placebo. Like any other cardiovascular outcome trial, they had another arm. There was one arm which had TZDs, and the other arm, the other molecules were used. The glucose control in both these arm was kept same in both these arms, and people were given 15 to 45 milligrams of TZDs in this arm, and they saw what was happening to the metabolic profile and various endpoints. The various endpoint that they have looked was, the primary endpoint was the composite of all-cause mortality, non-fatal myocardial infarction, stroke, ACS, endovascular or surgical intervention in the coronary or leg arteries, amputation above the ankle. So it is a very big composite event. The average time of observation was around 3 years for these people. So the secondary outcome that was seen was all-cause mortality, non-fatal MI and stroke. This is what the secondary outcome they had used. So let us not get into what this trial showed and all. To sum up very, very briefly, the secondary outcome, the composite of all-cause mortality, non-fatal MI and stroke was coming down with the usage of TZDs, and this composite was not showing significance. But the point that we need to take from this trial is, from this proactive trial is, whenever TZDs were used, there was an increase in the incidence of heart failure. So the authors were saying, like, there was an increase in the incidence of heart failure, but if you see the mortality because of heart failure, that was not increased. So whatever be said and done, now we have molecules where, like SGLT2 inhibitors, we know how it acts on the heart failure and how it reduces the incidence of heart failure, whereby we are able to see the mortality reduction. Whereas with the TZDs, it has shown very, very categorically that the heart failure risk is significantly increased in people with TZDs. Though, like we can say about a hospital admission, all these things, though the mortality was not showing an increase in the incidence of heart failure was predominant.